when it comes to long-term care, there's different reasons why you would need to receive that care. And those three reasons are medical, functional, and social. Okay. So if we look here, again, so there's three reasons why you would need to be in long-term care. The first is if you had some sort of a physical illness. An example of this is if you had some form of uncurable cancer. Now the uncurable part's important. I'm going to come back to that. So that's if you have a physical illness, medical need. The second way is if you have some sort of a functional disability. And this is some disability that prevents you from being able to operate on your own in daily life. And so for an example of this is some forms of mental illness, paralysis. Okay, so basically you need help and you need assistance getting this care. The third kind is if you have just some sort of a social need. And so you're not sick, you don't have a disability, but you're just unable to perform everyday activities on your own. And this a lot of time happens when it's the case and you also don't have any sort of support system in order to help you. So this is why you see elderly individuals needing to go into nursing homes. And they may not be sick, they may not be disabled, but they may not have the family support to provide them with the appropriate amount of assistance that they need. So they need someone else to help them with that. Now, placement into one of these facilities is going to depend on all these needs. It's going to depend on the medical, the functional, and the social needs. Okay. And so which facility is best all depends on the situation. And so this just kind of shows the dimensions of long-term care need and where you need to be. So an acute hospital, if you have a medical need, that's probably going to be the best place for you. Same with, if you have a medical need, a skilled home care. Whereas if you have a functional, a nursing home, or social need, those are where you're going to see the highest needs for it. Now, long-term care can either be home-based or institutional-based. The home health care can be used either to provide treatments for illness, and as medicine has evolved, that's become a little more popular than in hospital care. And the other way is by caring for those who are healthy but don't have a support system in place. So an example of in-home long-term care for people with social needs would be services that help them do everyday deeds. So for example, Meals on Wheels is an example of in-home long-term care for someone with a social need. Okay, so it assists those individuals. Now most people don't think of Meals on Wheels as long-term care, but in reality it is, because it helps those individuals when they need that assistance. With long-term care, there are notable and very distinctive differences from medical care. So if we compare the two, so acute medical care is what we've talked about so far in this course. There are differences when it comes to the goals and the cost structure. So with acute medical care, basically the hospital, the provider, they're trying to increase an individual's level of functioning or reduce their risk of death. So basically with acute medical care, they're trying to make them get better. So for example, if you break a bone, you go to the hospital to get care so that that bone can get better, so that you can get around better. Long-term care, however, is more on the supportive side. Okay. Now, the one thing I saw that is incorrect here, you're not trying to increase the level of functioning, you're trying to stabilize it. So you're trying to make it so, if there is a decline in a person's health or ability to get around, you're, kind of stopping that decline, or trying to slow it. So you're trying not to make with long-term care, they're not trying to help a person get better. They're trying to either slow down their decline, extend their life by slowing it down, or stop the decline, right, but not improve it. Now, when I talked before about uncurable cancer being a reason for needing it, that's why. You're not trying to, if you have uncurable cancer, you can't, the idea is that you can't make it go away, so you're trying to slow that person's decline to extend their life. Here's an important thing to note. With long-term care, because it's supportive, because you're not trying to improve, for the most part, once an individual enters long-term care, they're going to remain in long-term care for the rest of their life. Okay? So it's something important to note and remember. Now, when we look at the cost structure between long-term care and acute medical care is drastically different. When we talked about acute medical care, we talked about how medicine, doctors, nurses was a relatively large part of spending, whereas food, surrounding the rooms, social needs is a small part. With long-term care, the exact opposite holds true. There's a very small amount on doctors and medicine, while labor makes up a relatively large part of the budget. And I should say more money goes towards food, room, and social needs. Now, the largest portion of the budget tends to be towards the, and I use this term loosely, unskilled labor. And if you have ever been to a nursing home or any long-term care facility, you'll see that most people there the staff there is not a nurse or a doctor. They tend to be individuals who are helping the residents to do daily activities, bathe, shower, eat, socialize, stuff like that. So it's a drastically different dynamic when you compare the two. And if we break this down a little bit, this is a breakdown of nursing homes from 2005. You can see physician services is only 1%, nurses only 8%. Now there's other wages and salaries and employee benefits that makes up 57%. And then you see food, other supplies, and so forth. So again, those unskilled laborers tend to be a very large part of it. And so again, this is drastically different from acute medical care, with the reason being that the goals are different between the two.